Here we talk about part 3 of myths related to mental illnesses. Children don't experience mental health problems. That's not true at all. In fact, a lot of mental illnesses such as obsessive compulsive disorder, bipolar disorder can begin during their teenage or even at early ages than that. Apart from this, there are something called as neurodevelopmental disorders such as autism spectrum disorders or ADHD that have features that begin very early in childhood. And apart from this, neurodevelopmental disorders can also make children prone to developing other kind of psychiatric problems such as depression, anxiety, or behavioral issues such as irritability and aggression. Next, people with mental illnesses cannot manage the stress of their job or work. It is true that someone who is going through a very severe mental health condition might be unable to carry out regular work, but isn't that true about physical illnesses as well? However, in fact, it is seen that majority of these individuals who have mental health issues, when they seek and get the right kind of treatment, can become as productive as individuals who don't have a mental illness. Next, addictions are a sign of lack of willpower. This is something that I've heard a lot, and it's not true at all. Addiction is actually a legit chronic disorder of the brain which leads to an inability to stop using a particular drug or engage in a particular behavior even though it is causing obvious psychological or physical harm to the individuals. So when I say that, I'm not just talking about drugs of abuse such as alcohol, cannabis. I'm also talking of behavioral addictions such as smartphone use, networking, online shopping, and things like that. These individuals otherwise have a very normal willpower. In fact, recovery in these individuals is actually focused on challenging their willpower and developing strategies which preserve their willpower and help them in controlling their triggers in their environment, which cause them to seek substances. Next, you cannot prevent a mental health issue from happening. In fact, it's exactly the opposite. Just like being healthy and having a good lifestyle related activities, being fit and keeping a track on what you eat can help in preventing hypertension and heart related issues and cholesterol problems. Similarly, developing healthy coping skills, engaging in regular physical activities and exercise, doing good self-care related activities and hobbies, having a good social support and network of friends and relatives, seeking professional help when needed, and seeking appropriate social support are important steps that can help in preventing mental health issues as well. Apart from this, it is also important to be aware of the signs and symptoms of mental health issues so that early intervention can also take place whenever it is required, so that things can be caught early and treated.